in this chapter, we will give a high-level overview of the symptom patterns that we see with cervical spondylosis. So we'll start with that, talking about myelopathy, radiculopathy, and neck pain. Thereafter, we'll talk about the natural history of those different types of symptoms. So what happens if you don't do anything? If you don't treat them at all, how do these symptoms evolve? What's the natural course that they might take? And then we'll talk about different non-surgical modalities, things like medications, which are incredibly popular. We'll talk about physical therapy and the role that it plays. We'll talk about injections, the types of injections that are done and the rationale for them. And then we'll talk about even alternative stuff on a high level. And again, I'm not an expert on alternative treatment options, but we'll talk a little bit about the role of acupuncture and integrative health options and yoga, Pilates, traction, things like that. In the last section, we'll talk a little bit about how to apply that to a specific patient given their specific symptoms. And we'll talk about developing a non-surgical treatment plan, what that involves, and how it's done.